What's up, guys? Welcome to episode 18 of the Jibs Podcast. I am here with my friend and fellow podcaster, Rami, the host of Beyond Medicine.
It's just about getting up and doing it and finding the time, finding the people and making it happen.
You take control and you say, okay, this needs to be done, and you do it.
And you're never ready to start a business. You either do it or you don't.
Welcome to the Jibs Podcast, showcasing Detroit's movers and shakers, bringing you stories that reveal the gusto and grit that's long defined the city and its people. Together, we'll uncover the history and direction of the Motor City, one voice at a time. This is the Jibs Podcast with Jibran Ahmed.
How are you, man?
I'm doing good.
Let's just get right into it. What is Beyond Medicine?
Yeah, so I've kind of for the last year, I've been toying with the idea of starting a podcast. I've watched a lot of Gary Vee stuff and he just talks about starting a podcast. So I thought it'd be cool, especially within our medical community. And I guess I kind of got the idea of Beyond Medicine from I always wanted to kind of do, I've always been an outside the box thinker, I guess, so to speak. And I wanted to do something where I could really express my creativity and, do something I'm really interested in doing and something I find fun. So I thought it'd be cool if, I could kind of bridge the gap between, doctors, medical experts, and patients and everyday people. So I thought, and I saw that there was an opportunity to do that because there is a lot of medical knowledge out there. There is a lot of information out there, but how do we get it to people in a way that's engaging, that's interesting, and that's simple? So that was kind of my idea for the podcast. And then there's another part to that, and that's the kind of the meaning that Beyond Medicine has to me, and that's kind of going beyond your title, going beyond your profession, and not being limited to just that and being able to express yourself uniquely. So it's kind of a combination of the two ideas for me.
So how did you, I guess before we get into that, tell me a little bit about your personal journey and how it came to you, starting the podcast.
Yeah, so I went to Michigan State for undergrad, went there for medical school. I just graduated 2 weeks ago and just found out I'm going to be doing my residency a couple days ago. And that's kind of been my journey through medical school. And then I started a blog somewhere in my second year of medical school, and then started documenting things on Instagram, my whole journey. I started connecting with a lot of people. It's a very niche community, so we're all pretty connected in there, and we all share our advice, and we help each other out. So it's really cool to be part of that community. And so that also inspired me a little bit to do the podcast as well, because I've had a lot of support, I've had a lot of meaningful connections, and there's a lot of people that are doing cool stuff in the community, and then that kind of opens up your mind to it. So I think it's very valuable to connect with people within your space, because not only does it open your mind to things, it also, you can learn from them, you can ask them for advice if they're doing something you want to do. That's a little bit of how I got started.
Cool. And do you feel like through this journey of, connecting with people that are kind of the same journey as you, and then also while podcasting, connecting with professionals who have been doing these things for a while, do you feel like there are different niches in medicine that are sharing information with each other, or do you feel like that needs to happen more?
What do you mean by different niches, different groups within?
Different professions within medicine.
Yeah, so with our Instagram community, it's more all the kind of specialties, everybody from pre-meds to med students to residents to physicians. We all kind of are within the same general, community. I think there's a lot of overlapping. I'm sure plastic surgeons probably interact more with each other, different groups interact more with each other, but that's the really cool thing about it. It's it's under this big umbrella of just medicine, where it's like PAs, it's nurses, it's NPs, it's MDs and DOs. We're all kind of under this umbrella, and it's cool because you get to interact and engage with these people, learn about their lives, their stories, and then share your life and your story. And that, I think, is good for healthcare in general, because there's less of a, when you're in the hospital setting, there's a little bit of a gap between physicians, and other professionals. And you don't get that sense in social media. You don't feel like that separation, that ego, all the things that kind of like, hospital culture is kind of weird. So it's cool to get away from that in the Instagram community, in the social media community.
Yeah. Are there any challenges that you see like in the healthcare industry that you've been facing so far when it comes to interacting with communities on Instagram or through social media?
Yeah, so healthcare is a mess in general. Yeah. And there's so many things wrong with it. Specifically, what really I found striking just starting my clinical experience was kind of the culture of medicine. I think there's a lot wrong with it, and there's a lot of because it's a hierarchy. It's a hierarchy field. So, the higher you up in the hierarchy, the more the more prestige you feel, or like the more entitlement you feel. So there's kind of like this looking down upon people who are under you. So whether that be an attending looking down on a med student, or a nurse or something like that, there's kind of like this weird vibe you get, and you feel it a lot of the times. And I think that's for a lot of professions that have a hierarchy like that. I just think it's a little bit more pronounced in medicine. So yeah, that's one of the problems. Of course, there's all the things that are going on with healthcare, like the problems we have with getting people insured. With a big problem right now is the amount of paperwork and hoops you have to jump through with insurance and things like that, and trying to fight with them all the time. So there are a lot of things that are going on in healthcare that need to be addressed. And we talk about a lot of these things like through our social media accounts. We actually raise awareness because people talk about their experience, what they're going through, and a lot of us can relate because we see what's going on, and we try to relay that on to the rest of the community. And sometimes it's all just talk. Sometimes it's like maybe we're just venting, but other times like raising awareness eventually does lead to change. And it could inspire someone, or it could, in some way have a ripple effect that can lead to change.
Can you talk about a personal connection that you've made through the community, or maybe some piece of advice that was given through the community that positively affected somebody? Yeah,
also, everybody that I've interviewed on my podcast, minus one, has been just connecting with through Instagram, sending them a DM and saying, hey, I'd love to interview you and talk a little bit about, your expertise. I think that's been huge for me. I wouldn't be able to do any of what I've done so far with the podcast, which we're launching on Monday, so it's still the very beginning. But that's just been a huge tool for me to connect to people, just sliding in the DMs, yeah, so it's definitely been very beneficial. And I've had people's posts, some people who I look up to share a lot of really interesting things. For example, just recently, sorry, I'm just going to get a sip of water. So just recently, so I didn't end up matching through the match, and that was a really hard blow for me because, in med school, that's kind of the thing you do. You go through it, and at the end, you kind of match with all your friends. That wasn't the case for me, so I struggled with that in the beginning, and a big reason why I was able to cope with it so well was, some people who had reached out to me on my Instagram because I had shared the news with them, and they gave me an overwhelming amount of support. So that made me feel like I'm not alone in this, and people were just very, very supportive. And then other people shared their stories as well, and I saw, okay, this isn't the end of the world for me. Just because this happened, it doesn't define me. It's happened to a lot of other people before me, and it's going to happen to people after me. So and that was all through my Instagram, through my social media account, where I had that tremendous amount of support, and it was really, really helpful for me.
Med school and the healthcare industry, I feel like, has a high amount of stress on the people involved in it.
Yeah, look at my hair.
And I think this is a really good testimony to the power of support in people that are going through the same journey as you and the same experiences as you. So I mean, on that note, what are you hoping for in the next year or 2 years for this community?
So from my standpoint, my goal, the whole reason I started it was to help people who are on the same journey. So my journey is a little bit different than other people's journeys. I was kind of going through I had the underdog story, where I faced a lot of adversity. So I was the guy in high school that was flicking paper balls in the back of class, like paper footballs, and I didn't have good grades. I was smart, but I didn't have good grades. And then in college, I was pretty average. And then I flunked an entire year of classes, and I had to come back from that. So I remember, I know what that feels like. So I kind of wanted to put that out there for people who are in a similar position, or people who might go through something similar. And if they can hear my story, maybe they'll feel like, oh, I can do this too, or if he can do it, I can do it. Because when I was going through it, I got a lot of discouragement. There was a lot of negativity. I didn't have someone to look to, say, okay, he did it. Maybe if he did, I could too. And I kind of wish I did have that. I would just go on SDN. It's like this blog for medical students, and I'd read about everybody's 99th percentile scores and how they're worried about getting in, and I'd be like, oh my God, I don't stand a chance. So I think it's good for people to know that you don't have to be stellar. You have to work hard. You have to be persistent. You have to believe in yourself, most importantly. And I try to be that source of inspiration for people, especially on my Instagram community, and especially when I feel like I have a soft spot for people who are struggling through that. When I get a message and I think oh man, I've been there. I know what it's like. I have a soft spot for that, so I try to help them and try to make them realize don't worry, it's gonna work out. Just keep doing what you're doing, work hard, it'll happen. And sometimes I have to look back at my own story and realize, oh man, I made it through that. Okay, I got to take my own advice. Mm-hmm. Yeah.
For aspiring doctors that are listening or watching, or people that want to be a part of the healthcare industry in the future, what kind of tangible advice can you give them?
Don't do it.
For people going on this journey. Don't do it?
No, but seriously, don't do it. But also only do it if you can't imagine. This is at least for becoming a physician. Right. To do that, I think you really have to be honest with yourself, and it has to feel like it's something that's coming from your soul. Something very strong is pulling you towards it. Because if you're iffy, or if you're doing it for the wrong reasons, if you just think it's cool, it looks cool on Grey's Anatomy or on TV, definitely you should rethink it. And I say that, and some people get discouraged when I say that, but I don't want people to go through it and then feel stuck, because once you're through it, once you get in it, it's hard to get out, because now you have debt. Now you have a tremendous amount of guilt if you do get out of it. So there's a lot of things that once you're in it, you're in it. And you don't want to put yourself in a bad situation. And then I would say that if it's something deep down inside you want to do it, there's no better profession out there. Especially if you feel like it's the right profession for you, if you have that calling, if you feel like deep down this is what you want to do, there is no better profession out there. We, just as a profession, as doctors, as nurses, as PAs, we have to bind together and solve the big problems that healthcare is going to face, because a lot of the problems that have been happening in healthcare right now are because administrators, CEOs, they don't care about doctors, they don't care about nurses, they don't care about the patients. They care about their bottom line. We need people, we need more physicians, we need more nurses, we need more people working to make healthcare better. And that has to come from the people who are in it. That has to come from the doctors. That has to come from the nurses. That has to come from within, because we know the problems that we face, and we know the problems that patients are facing. So if these things are going to be solved, they have to be solved from within our own community. And so we have to kind of promote this idea that, and this is also a part of Beyond Medicine, we have to promote this idea that we're not just our titles, we're not just our professions. We can be these problem solvers. We can be the people that make these changes. We can be the people that fix healthcare. That's really, really, really what I want to eventually, get people to realize and get people to become a part of. And I want them to believe in that idea that they're not just their title, they're not just their profession. You can become the CEO of a hospital. You can start this new revolutionary direct primary care practice and solve a big part of the things that are wrong with primary care, like the person you had, Plum Health. I think they're doing a great service. And it's things like that that really inspire me.
So let's talk about some of the problems. To you, what are the top 2 biggest issues that you're passionate about in the industry?
For me, so one of them would be the bureaucracy that's going on in medicine. Insurance, paperwork, it's actually pretty miserable. I've seen a lot of doctors who are just fed up. They want to quit medicine. They've worked their whole life doing it, but they can't take another second talking on the phone, telling, some guy with that's like right out of high school, telling him why this patient needs this treatment. It's actually kind of ridiculous, because it's almost like the doctors aren't even making the calls sometimes. It's the insurance companies that are, and it's actually kind of ridiculous. So that the bureaucracy is a big part of the problem. But when you have direct primary care, where it's a membership-based service and you don't take insurance, that's one whole element that's one thing that's taken out of the equation. You can focus more on the patient care and the problems for the patient, instead of worrying about how you're going to make ends meet and how the patient's going to afford it, and whether insurance is going to pay for all of this. So there's a lot of problems that it solves. And bureaucracy is one. I would say culture is another. Physician suicide, man, it's a big issue. I think the last study that came out showed that physicians were twice as likely to commit suicide than the general population, which is nuts. And just a couple of weeks ago, 2 med students from NYU, committed suicide. And a lot of it has to do with the culture of medicine. People are burnt out. People feel like they're trapped, feel like they're stuck. And I think it's kind of sad. I think those are the 2 big issues.
So for people listening that are already on this journey, that are stressed or feel trapped, let's talk like some tangible things that, looking back, how did you work more efficiently? How do you work more efficiently? Like, what kind of tools have you been using just to make your workflow better? Yeah,
so first, anybody feeling that way, feeling like, they're at a dead end, or feeling depressed, or having any suicidal thoughts or anything like that, the first thing you should do is talk to someone. Talk to someone, anyone. Talk to someone you trust. Tell them how you're feeling. Because just talking to someone is going to make things a little bit better. And know that you're not alone. Sometimes when you're going through these things, your brain's not it's not thinking clearly. When you're depressed, when you're going through when you've had a traumatic experience, sometimes that impulsivity is what's really dangerous. So people go out and they can harm themselves, when otherwise, when they're not in that state of mind, they would never do that. So don't act on your impulsivity. Know that you're not alone. Know that other people have been through this. Know that you can reach out to your family, to your friends. There are people that want to help you. So that's the first thing I would say to anybody that's feeling like that. And I'm sorry, what was the second part of the question?
So tangible advice is like working more efficiently.
Oh yeah.
Like
So yeah, definitely. Self-care. we talk a lot about that in our community. It's taking care of yourself. It's eating right. As hard as it is to do, you don't have to eat right all the time, but trying to eat right, that has a big effect on your mood and your attitude and things like that, and your energy levels. And another thing is exercise. Like, these are so like cliche things, but really they make a difference. Exercise has been proven to be just as effective as an antidepressant in reducing depression. It's just as effective as an SSRI that you get prescribed. So do those things, they help. And don't be so hard on yourself. When I found out I didn't match, I was really hard on myself because I have very high expectations. And when you have high expectations for yourself and you don't meet them, that leads to depression, that leads to sadness, it leads to those things. So I knew that even though I had these high expectations, because I didn't meet a benchmark, didn't define me or my capability to do so in the future. It was just a small setback, and I was going to have to recoup. And I kind of took it as a sign, as an opportunity to look at this and an opportunity to grow. So I think keep the right perspective also. And if there's a setback, use it as an opportunity, because if you do, you'll grow from it and you'll become stronger. And you'll be able to handle these things better in the future. So there is good things about like these kind of things happening. There's always there's always a positive. So try and focus on that. There's always something positive. I would rather get punched in the mouth right now when I'm 27 and face some adversity rather than have a smooth life, be smooth sailing, and then get punched in the mouth when I'm 40. And I have a family and I have people relying on me, and my whole family gets punched in the mouth. Right. So there's always a positive to something. So these things that you go through, these hard times, they make you stronger for the future, and they make you more resilient, and they add to your character too. So there's always a positive.
Just a couple more questions. What life event that you can think of, maybe in your childhood or when you were in high school or whenever, has had a huge impact on your life that you can think of today that has affected the way that you are today?
Yeah, that's a good question. I would definitely say, some of my family's struggles growing up, financially or whatever it may be, other struggles. I think that's shaped a big part of who I am. It's part of the reason why I feel, why I have like a bit of ambition. I definitely think that has a big part to do with it. And also the support that I've gotten from my family, the amount of things that they've done for me, the amount of effort that they've done, the lengths they've gone to kind of make sure that, we had everything we needed to kind of make it through this and to kind of be something. I just kind of have an extreme gratitude for my parents and for all that they've done. So that's also given me this outlook on life. Like, I'm very lucky, very blessed to have grown up, number one, here in the States. If we live here, we're already in the 1%, man. Like, we have so much to be grateful for. So that, like, just having all those experiences, having that support from my family, and then, seeing them handle their struggles and still, give us everything we ever needed, really gave me a sense it gave me a sense of feeling like I feel like I have a responsibility to give back, to make something of myself, to have a purpose, and to not just kind of glide by in my life, but to really try to be something and make an impact and have a purpose. So I think everybody's childhood, the more adversity you face in life, a lot of people don't have good role models. A lot of people don't have good parents. And they may have gone through their own struggles in life, but every one of those things can be taken, and with the right perspective, that can make you, that can shape you for who you're meant to be. The more struggles you have, I really think the stronger you can be, throughout life. A lot of these You know, a lot of these billionaires and these CEOs and entrepreneurs and people who have done things that are really amazing didn't have the best childhoods. They didn't have everything come to them so easily. You know, they had to work for it their whole lives, and it's a blessing in its own way.
Mm-hmm. I think that's some great advice to end on for people listening or people watching. Where can they connect with you?
Yeah, so if you want to follow me on my Instagram, it's at drrami.do, and it's spelled DOCTOR, Rami, RAMI.do. And my podcast is going to be on iTunes on Tuesday, and that's at Beyond Medicine. And you can follow the podcast also at Beyond_Med. So, you know, we'll be trying to bring experts, thought leaders, you know, people who have done something really cool in medicine or have some really inspiring ideas or just have really good expertise about a certain subject within medicine. And, you know, we'll bring you practical advice, things that you can use to better your life, to, you know, be the best version of yourself, to grow. So all kinds of people are welcome, health enthusiasts, people that know nothing about medicine. You don't have to have a background, you know. That's what the podcast is for, to break it down for you.
Mm-hmm. Awesome, man. Well, brother, I appreciate you coming on the show.
Thank you for having me, Jibs.
Yes, sir.
My man.
Until next time, guys, stay tuned.